All right. I will call this meeting to order. We'll start with the consent agenda. All the following items which concern reports and items of a routine nature normally approved at AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all of these items. The consent agenda consists of the discussion, consideration, and action on the following items. Minutes of the monthly finance meeting on February 16, 2016. Minutes of the monthly trustee meeting on February 16, 2016. And a check report February 8, 2016 through March 7, 2016. I would entertain a motion.
I move we approve the consent agenda.
A second.
We have a motion by Dr. Brown, a second by Darlene Sanderson to approve the consent agenda as it was presented. Roll call vote, please.
Brown,
Yes.
Klein,
Yes.
Gaspard,
Yes.
Hannaford,
Yes.
Sanderson,
Yes.
Simon.
Yes.
I don't need this
The next item is the CEO's report. Candace?
All right, looking over the data that was submitted, you can see that PT visits are finally, we're getting back up there where we used to be. We've started swing bed over here at the hospital. That seems to be going very well. We had our first telehospitalist patient, which happened to be one of our swing bed patients, that we connected with, and it went really well. If you probably saw the paper on Sunday, Lynn had a good article in there about that family and how things went. I was amazed how well that Dr. Rader was able to hear her. She speaks very softly, and I thought, this is going to be a train wreck. He's not going to be able to hear her. She's very soft-spoken, and he heard every word she said the first time she said it. She never had to repeat herself. I was amazed. So it's been going well. No complaints at all. And I think Dr. Kinsey has had a patient actually on the service before you left on vacation. Didn't you do one? So, you all right with it?
Yeah.
Has it been going all right? Good.
She seemed happy, so.
Yeah. Let's see. We've got Brian Nutter. We've moved him to the downtown clinic to start his primary care practice, and it is filling up. He's busy, and we're happy about that. We have an ultrasound tech. Now she's coming out 2 days a week instead of one, and we're looking to maybe add another sleep night, I guess, to our sleep studies, because those were booked out so far. Volunteer hours were over 200 hours for February. You can see of course, we're always hiring CNAs, and EHR, still waiting on the EHR money. Kevin has checked on that, and it says it's pending still, so hopefully any day that will be released. eClinical seems to be going okay in the clinics. Really that. Looks like we've got one Northwestern senior student that has committed to working to Share Medical Center after graduation. So that's a good thing. Something though I would like for us to work on is doing like a luncheon. You've got two coming, Rita's got two coming. Every year, let's just do it at the same time, so that we kind of make a tradition out of that.
Okay.
We'll get with Regina and try to do that. Maybe in their junior year.
When they're accepted into nursing.
When they're accepted into
The
nursing.
nursing program would be the best time.
Okay.
As a freshman?
That'll be the junior.
Their junior year,
Yeah.
okay.
Junior.
Okay. It's been busy, and we like being busy, so. You guys have any questions for me?
Well, we might report, not necessarily have to say names or anything, but you have contacted several doctors.
Yes. We
And
had,
interview.
we've had 2 interviews actually since the last time we met. One that we did last week was great. I think he would be a great fit for us, great fit for the community. We've got 2 others that we're talking to. They're still a couple of years out. You know, we're always working. We're trying to recruit. It's pretty thin out there. There's a definite shortage, and it shows up. So we continue to work on it. Continue to pray about it. So there was something else. Hang on. You made me think of. Oh, I know what it was. So with this transition that we've had in our emergency room, we've had a lot of locums coverage in the emergency room. One did not work out so well, and so if you hear some complaints, I just want you to know that we are addressing it. That doctor will not be back, and it is tough on staff. So we know that, and we're working on. You sitting there like grinning, you've heard it too. So we are working on it, and it's just one of those things. You don't know what you're getting into till you try it. So it wasn't a good deal for our patients. So we'll fix it.
Anybody have any questions for Candace?
What, maybe for anybody, but kind of the legislation that was maybe to help kind of the mid-levels do a little bit more, is that still,
Didn't that die, Bridget?
It did.
It did?
It died this year.
Unfortunately, it
Yeah.
did.
is there a reason? I mean,
It's pushback from the physician organization more so than anything. They're just concerns about their training, and so it really is coming from the medical organization. So I think with time it'll roll around. It's that they're not ready for it yet this year. Lots of campaigning against it from that organization.
But Jimmy said there was a lot of more talk this year.
Absolutely.
And more,
He felt like, there's just probably because there's so many other things that are
In
going
health.
on right now,
Yeah.
but he felt like it probably would get some momentum next year when it rolls around, which we certainly all hope that's the case.
Yeah.
thank you.
Any other questions? If not, I would entertain a motion.
Mr. Chairman, I'd like to make a motion to approve the CEO's report as presented.
Second.
We have a motion by Terry Klein and a second by Dr. Hannaford to approve the Share Medical Center written report. Roll call vote, please.
Klein,
Yes.
Gaspard,
Yes.
Hannaford,
Yes.
Kinsey,
Yes.
Sanderson,
Yes.
Simon.
Yes.
Brown.
Yes.
All right, Candace, thank you. Next, Kevin, CFO's report.
Okay, February, we grossed $1,660,674 worth of charges. That was a $34,330 increase compared to the prior month. The hospital charges increased by $69,356. The nursing home decreased by $33,586, and the homestead decreased by $1,441. Total patient days for February were 95 compared to 71 in January. Hospice days for February were 63 compared to 69. Total clinic office visits for February were 1,078 compared to 1,107 in January. In the nursing home, average daily census went from 53 in January down to 51.4. Hospital contractuals, less bad debts and charity for February was 54.7%. We wrote off $75,515 to the collection agency. We gave $360 away in charity care. We had a net operating loss for February of $239,994, but after sales tax, donations, and other contributions, we had a net loss for February from all three facilities of $142,631. At the end of February, we had $101,322 cash on hand, which represents 3 days of operating expenses. Our accounts receivable decreased $24,255, which meant our gross days for February were 62.4 compared to 67.1 in January, which was a 4.7 day decrease. Our net days went from 51.2 in January down to 48.7, which is a 2.5 days decrease. Accounts payable for February was $792,669, and that represented 59.9 days of operating expense. If we flip over to page 2, of course you can see the revenue is almost identical from month to month. The biggest change you'll notice is probably in the other expenses. It's down almost $70,000, and that was due to the fact that last month we had to pay the shop payment, this month we didn't, so that was really the biggest decrease there. Of course, salaries and stuff were down. We had 2 less days in February than we did in January, and like I said, we lost $239,994, and with sales tax and everything, $142,631. On the next page, the other expenses. Really the only line item that did go up, and it'll go up again next month, is in purchase services. We have to start using a lot more ER locums coverage in February, and then in March is going to be the whole month, and we will definitely see a huge increase there for this month of March. We're working on recruitment for getting nurse practitioners and PAs back there, and hopefully we'll have that resolved maybe by the 1st of May is what our goal is, try to get that all resolved as far as that goes. Looking at the page 4, the 2 years side by side, you can see we're up about $29,000 compared to last year at the same time from all of the facilities. We're losing $1.8 million this year compared to $673,000 net loss last year. But the biggest difference of that was the EHR money we had last year that we have not received yet this year. So it is down. We are a worse loss this year than we were last year, but part of that's due to the EHR money not being there. The other part, we're at $370,000 net profit last year at this time compared to $993,000 net loss. The other big area that you'll notice is the sales tax went from $1.2 million last year to just a little under $1 million this year. So we're off almost $300,000 in sales tax as well. So those two factors contribute to the loss that we have. The hospital by itself on page 5. You can see the hospital's net operating loss for the month was $261,725, and with sales tax, $165,387. Year to date for the hospital by itself, it's got a net loss of $950,325 compared to a net income of $530,804. But again, remember last year we had the EHR money of almost $700,000 plus. We're off another $300,000 in sales tax for the hospital. The nursing home, if we look at it, its revenue was down, but it's also its expenses were down as well. They've really been working on staffing levels and stuff, and it really shows up in the month of February. They made $1,324 from operations, and with other contributions, $2,349. So Rita and their staff's done a really good job of really focusing on the staff that we have there, and it definitely shows. And so they're really doing a good job. It's 2 months in a row they made a profit, so that's really a positive for them. Page 9 is the homestead. They, like I said, had about a $1,400 decrease in revenues, but they continue to make a profit. They made $20,408 from their operations, so they continue to do a good job as well. Page 11 is our accounts receivable. Really the only thing there is the end of February, we had a little bit of an increase in the unbilled. We went from $343,000 in January up to $457,000 in February. That's something that we have got to watch and make sure we get done. That's working with physicians to get the H&Ps and stuff out. But our volumes for inpatients has greatly increased, and that also you have a lot of money tied up in a few claims too as well, because you might have a $6,000 or $7,000 claim where you might not have that much in the outpatient, so it takes a lot of those to make an inpatient claim. But overall, the AR for the month, like I said, decreased right at $30,000. Page 13 to 14 is your balance sheets, and then the rest of the pages is all the different statistical sheets that we have for the hospital. Guys have any questions?
Any questions for Kevin? Well, hopefully, here in the next 2 months, those numbers look different with the cost report and the EHR refund.
Right.
So, okay. If not, Kevin, thank you. Next is Dr. Kinsey and the Medical Staff Executive Committee report.
All right, so reviewing the agenda, it was kind of a thin month for the Medical Staff Executive Committee. We approved the TB risk assessment and the hospital risk assessment that had been reviewed but not changed during the CLOPI meeting. And then we recommended appointment to courtesy staff of Dr. Portner, who's working part-time in the emergency room. And that was about all the business we got done. We did have a discussion about how to treat some conditions in patients who come to the urgent care for their care. Because we're still trying to get them to use the urgent care for urgent stuff, but still have a primary care provider, and we're trying to balance how we do that. So we had a nice discussion about that. For credentialing committee, I move that we appoint to courtesy staff Dr. Robert Portner, DO.
Second.
I had Kinsey. Who seconded that?
Kayla.
Okay. All right, I have a motion by Dr. Kinsey, a second by Hayla Simon to appoint to courtesy staff Dr. Robert Portner, DO. Roll call vote, please.
Gaspard,
Yes.
Hannaford,
Yes.
Kinsey,
Yes.
Sanderson,
Yes.
Simon,
Yes.
Brown,
Yes.
Klein.
Yes.
That's
Anything else?
all I got.
All right, well, thank you. There's no CLOPI report this month, so we'll, under patient review, do we have any?
We don't have anything for that
Okay.
either.
So we'll skip 6 and 7, and we will move to the shared convalescent home report. Rita?
That's fast.
Yeah.
Well, I'm windblown. We got a busload of residents to Canton today. And they were all winners. I wasn't. That's okay. I had to hurry back, but they all had a really good time. Valentine's Day in February, we had a nice Valentine's party. Everybody made their own Valentines and gave them out to wherever. The meetings that Christy and I attended and that's actually in March, but I'll report that in March, were very helpful. There's a lot of talk about the UPL. It still looks like it's gonna go. I don't know. They talked several times about how that can help save rural hospitals is by having that, because it affects the hospital part of that. Our census for skilled, of course, is going down, and it will continue to go down. We'll be able to see that, but in hopes that that is reverted to the hospital, and there's various reasons for that. Kevin knows those reasons. Our census for February actually had climbed pretty well and stabilized, and then at the end of February it just kind of went, but it's back up and it's stable. If we can keep it where we're at, I'm not going to worry about it. I do have, once we discharge some of our short stay people, I will be looking to move. We're going to try to move our heavy care together and our less care on the other end for staffing purposes. I think that'll help alleviate some issues that we're having right now. Employees, I do have a lot of nurses that's going to be graduating and they're going to be leaving. I do think I have a commitment from 2 that will at least stay for a short period of time. And we have new ones that will be taking their LPN boards for the summer. And we'll be training them and putting them in place. And then we have like 5 LPN students in the technology center. They won't be finished until October, but we're waiting on them. Hurry. We can't hurry fast enough. We did hire an RN that has some long-term care experience, and she drives from Buffalo, and she seems like she's going to be a really good fit. She's excited about working. She's been orientating this week, and we're excited to get her started. And I think that's it. Do you have any questions?
If not, Rita, thank you very much. Did any of them win enough to want to make a donation to the family?
You know, they like to play pigs.
I see.
Now, I'm not saying you can't make money off of things that are like 20 cents.
I see. All right, next, Kelly, the homestead report.
The homestead had another, as far as I can tell, looking back through all the records, another record-breaking month. Be the 4th one in a row for paid occupancy at 88.3% occupied. We actually have 2 other rooms that are occupied as comp deals for staff. But so that was almost 48 rooms per night rented. Kevin mentioned the revenue being down. That's largely because we had 4 residents spend almost the entire month of February in either the hospital or skilled care. And so we charge a reduced rate whenever they're not taking services at the homestead. So that would have amounted to about $1,600, and we were down about 14. So our revenue would have been up had we had them there on site. It was we have had since then in March 2 apartments moved out, but 1 more reserved. So we're going to be. I think still okay. We won't have a record-breaking month in March probably, but we'll still have a good month. We started some initiatives with the activities with the Oklahoma Healthy Aging Initiative. They're coming in and helping us provide healthy lifestyles, healthy behaviors, both education and exercise programs for our residents, and they've been highly attended. We had a Tai Chi program that had in the neighborhood of 20 residents participating in it on a regular basis. And from what their instructors told us, we were one of the most participated programs in all of the state, and even with some much larger facilities. So that was good to know. We last fall, the Woods County Election Board asked if the homestead would be interested in being a polling location, and so we had our first election with the presidential primary held in our activity room at the homestead, and that I think voting numbers were up everywhere. I'd like to say that our precinct was just because it was at the homestead. But we did have actually out of that, let's see, one tour to somebody that came in and thought, well, this looks like a not bad place. Can you show me around? So that turned out all right. And we're getting ready from an activity standpoint to have the Christian church will be providing their sunrise Easter services out by the ponds. So we'll have the fountain in the backdrop with the sun coming up. It should be a really nice service Sunday morning at sunrise, 7:20ish. We are recruiting for, we've been interviewing and accepting applications for a resident services coordinator, activity services coordinator. And other than that, our position, we have still some part-time work available for the kitchen. The hot water heater system, I talked about it at the last hospital authority meeting. We have been functioning on 33% of our capacity with one of 3 hot water heaters working. The city is reviewing final quotes to go ahead and get approval to move forward with that project. It looks like it'll come in under the amount required to go out for formal bids, but it will be an amount in excess of what can be approved through regular budgeting. So there will have to be a council vote to approve that expenditure when it's time. Once approved, the contractors are, depending on which contractor, but probably 2 to 3 weeks for installation. It's a little bit more in depth of a project than maybe anybody had hoped. So, I think that's it. If anybody has any questions, I'm happy to try and answer them.
Any questions for Kelly? If not, Kelly, thank you. Do you have a foundation report?
Just briefly, we're working on wrapping up the project for the automatic doors at the nursing home, and we're also preparing to have our annual, we're combining this year donor and volunteer appreciation, and that'll be April 21st. That is a date change. We had scheduling conflict at the venue, so that'll be April 21st at 6 to 7:30 in the Ranger Room at Northwestern.
Okay. All right. Thank you. Next is St. Anthony's report.
Okay.
Bridget?
You'll have to forgive me because I have congestion, so hopefully you can understand me. I think since the last time that we've met, Chuck Skillings, who will be my new boss, came down and met with Jason and Candace and Kevin just to kind of introduce himself and kind of tell his role. I wasn't sure what the board knows or doesn't know, but Kyle has taken on some additional responsibilities within St. Anthony since he's truly the operations person, and we are growing, which is great, but it is causing him to have less and less time to spend with the affiliate network. So Chuck has a little bit more time to dedicate. So and Chuck and Candace and I have always had a long-standing relationship, so it's an easy transition for me, so I certainly wasn't bothered by that. I know that Kyle has lots of grief about giving up something that he built and he loves, so I know that he will miss visiting with everybody, but he will still be present when he needs to be. But Chuck will primarily be our point person who will get in the car with me and travel when we have some opportunities to visit. So one of the things that come out from that meeting is that we want to try to get together with the Northwest Oklahoma hospitals, hopefully with maybe a couple of board members and the CEO and CFO, and really do some just some development on seeing what we really need to focus on this year. I think we'd be remiss if we weren't concerned about all the cuts. I think, every time you turn on the TV or read something, you keep hearing about the state of funding with Oklahoma, and they just did the 4% additional cut, so that's 7% cut to Medicaid funding this year. So I'm not sure exactly what dollar amount, but I'm sure it's in the $100,000 that impacts Share Medical. So every time you turn around, there's $100,000 here and $100,000 there, and I presume this meaningful use payment is probably your last payment. So we all have to figure out how to operate in this new healthcare environment, which includes the mandated electronic medical record, which is very expensive to maintain. And so a lot of hospitals are finding themselves having to kind of regroup and take that money out, look forward, and say, what do we need to do in this next year? So those are the things that we want to talk about, to be sure You know, y'all have been in a position before where you know, cash has been tight, and when you know it's coming, you can prepare for it better than when it sneaks up on you. So that's really our intent, is to try to be prepared for what is coming over the next 6, 12, 18 months.
And have you set a date for that yet?
No, I'm waiting on Stan and Krista to tell me
Okay.
their dates that are available.
Okay.
So I'm hoping we'll have that secured pretty quickly.
Okay.
So we want, like I said, we really want to take some time and focus to see, you know, collectively what everybody's thoughts are about how we, you know, approach that, and how can we share ideas among our network to try to strengthen and grow in an environment where it's hard to grow. I mean, it's hard to grow, and you can't cut yourself to a profit. So it's going to be a challenging couple of years that are coming up on us. We visited about physician recruitment too, and I think Candace had a separate meeting with Krista and Stan to discuss some physician recruiting opportunities with St. Mary's. So they'll continue those conversations. Hopefully some of those will be successful. We certainly will continue to work from our side to see if there's some opportunities within our residency program to try to grow some that'll want to go out into the rural areas. Dr. Rader and Jimmy Durant came out for your chamber meeting. We appreciate y'all inviting us to that and letting us be a part of it. I think we've expressed over and over and over again recently about how important it is that we get the message out about where our hospital stands, where we're going to be in the future, so that they can make good decisions at a state level. We do have the upper payment limit, and there's some regulatory things that have to be changed within the healthcare authority, plus at a state level with the certificate of need, to be able to make that possible for us to enroll in. So we want to be sure that you know, that they keep their eye on that and make those things pass. One of the problems right now with that particular program is that the state is trying to fill their budget gap, so they're kind of trying to tag on to that program and say, well, give us 35%, and then y'all can split the rest between the hospital and the nursing
administer
home.
it.
To administer it, which is completely ridiculous. So it's going to be another interesting thing to follow and see how it kind of comes out, because I don't think any of the hospitals and nursing homes are going to be willing to give up that 35%. So it is political in its nature, and so we have to be sure that they understand that, you know, that money is critical to these hospitals and to the nursing homes, and the state needs to figure out other ways to fill their budget gaps, and all that money needs to stay with us. So the advocacy dinner and the day at the Capitol is coming up on the 25th and 26th. I'm sure Candace has mentioned that to y'all, but anybody that could participate in that
I'm
would
in
be.
Mexico. I haven't mentioned.
You were in Mexico? wish
I
was
have
in
not
Mexico.
mentioned that to you.
Okay. Well, it is coming up on the 25th and 26th. That is something that OHA hosts within the advocacy group. So we're highly encouraging at least one board member and a CEO to come, so that you can sit at the same table with all the group of the folks and have conversations with them and talk about your hospital, so that they understand, you know, where you're at and what their decisions are being, how that affects you in this rural market. So she can certainly get you some more information out about that. Along with the telehospitalist program, I think we've been trying to help with PA supervision and the nurse practitioners, so hopefully they're helping out a little bit to ease that up a little bit, particularly for Dr. Kinsey, because I know that a lot has fallen in your lap with some physician shortages. Yeah. So hopefully we're helping fill that gap as well too. So I think that's pretty much what was on our list. I just wanted you to know that we do have a true concern about how we work through the next 2 years. And so at any time, if y'all have questions or concerns, certainly, you know, let us know. Because it's going to be interesting navigating that environment. And we don't know if Medicaid's going to cut more. I mean, there's still more talks about, you know, if they can't figure out a way to fill those gaps, it could be more than the 7%. And it's on the provider side, it's on the hospital side, it's on the nursing home side. Nobody is exempt this time. So it could go up to 10%, 12%. Sometimes they've said 15%. So that's unfortunate because there could be lots of changes in people's practice patterns, and you can't blame them for it. And then, I don't know. So there are lots of things that we have to tackle over the next couple of years. So I didn't mean to be Debbie Downer, but it truly is.
Well, you were.
It truly is where we're at, and we're concerned about it severely. And so we want to try to be a good partner in trying to navigate that world. So anyway.
On the UPL, in the 35%, has there been any counter to that you know of?
They've had open discussions about it that I'm aware of, because they do have to hire somebody and they have to pull the data, and it has to be administered, no doubt about it. But that could be done with 3%.
Isn't the shop payment like 3 to 5%?
Other states don't have an administrative fee.
No, they don't. But it wouldn't be unreasonable to ask, considering our shortfalls in our budget, to ask for 3 or 4 or 5% to cover that, and maybe have a little bit left over. I think that's reasonable, but
Because that's what one of the legislators that I talked to, that's what was discussed. But this is the state health department that's wanting the 35%.
right, the Medicaid, OHCA. Yeah. So Nico Gomez. So it's just unfortunate, but hopefully, like I said, if everybody will be educated about it and understand it, then maybe there can be a neutrality to it. But I would think anywhere from 3 to 5% would be very sufficient to cover any costs that they would have associated with taking the federal funds.
Okay. All right. Any questions for Bridget? No, Bridget, thank you.
You're welcome. Thank you.
Next, Bo, you got anything from City Council?
Just a couple things. Short meeting last night, but a few things were discussed. Kelly just mentioned the water heaters for the homestead. We hope to get a couple of those replaced soon. And then a couple other things that would affect this area. The 8th and Young and 8th water replacement. The water line is about hopefully 2 weeks away from being completed. And then I know some of the first projects that they'll do with the city streets will be up in this area with Sunset, Murray Drive. We'll be resurfacing those, and then working their way down to some other streets. We continue to prepare for the budget, getting ready for budget meetings, getting some information from all the department heads. And I think the other big thing that I did write down from even the previous meeting, we did renew our city manager's contract. And I think that was the big thing, unless anybody has any questions.
Any questions for Bill? If not, thank you. There are no other items of new business, so we are adjourned.